Doug asked me if I could spend a few minutes just kind of as a welcome, but create a little bit of a context. And unfortunately, I have a mouthful of salad. Two things. One is that the situation we find ourselves in around healthcare has two serious ramifications. One is our economic competitiveness internationally, and I think it's a more significant factor than we often are willing to admit. And secondly, the systemic opportunities to improve efficiencies. And as society's appetite for improving and more expensive health care increases, if we don't find ways to get that efficiency improved and increased, we're going to have a serious problem. What we're here for today, and I've got lots of statistics that the city spent a great deal of time and effort trying to really make metropolitan Denver the health and wellness center of the country. And we are focusing everything from the nutrition and the cardiovascular activity of our school kids to trying to get to 10% of our commuting population to come in and out of the city on bikes. I can go down the long list. We're going to try and, in partnership with several nonprofits, try and get 2,000 neighborhood gardens started this summer in people's yards and in public space around neighborhoods, just on that sense that not only does it promote people eating better, but it also is good exercise going out and working in that garden, as I learned the hard way by my mother forcing me throughout my childhood to be I was her ace weeder. She didn't really like to bend over. She figured that my back would last forever. She was sadly mistaken. We also try to make sure that we have healthy grocers in every neighborhood. We have a Living Streets initiative that last fall we brought out a strategic transportation plan that instead of just looking at car trips and how do we make our road system accommodate the maximum number of cars, let's look at every form of mobility and be agnostic, as public television would say. That's a better word than all those nons. How can we look at walking trips and bicycle trips and connect those with light rail and make sure people have mobility but get more exercise and also create less traffic? We're very fortunate, and you'll hear more. I won't steal any of your thunder, but we have a healthcare system that I think is the envy of many cities in the country. Roughly 150,000 individuals receive their health care at Denver Health or through their various clinics around the neighborhood clinics around the city. That's roughly 25% of all Denver residents. 1 out of every 3 children in Denver is cared for by Denver Health physicians. And they, with all that pressure, right, and there's tremendous financial pressure I'll get to in a second, the American College of Surgeons named Denver Health's trauma system the #1 trauma system in the country. But at the same time, you have to look at the economic pressures of those 150,000 people. A lot of them are in the lowest economic segments of our population. In the last 10 years, Denver Health has provided more than $2.1 billion in care for the uninsured. Now, nearly $300 million of that care was provided last year, and more than 40% of the care, of the total care that the hospital provides, goes to uninsured. Somehow, only through the miracle of sheer will, and Patty Gabbo, who you'll hear from in a little bit, they've managed to stay in the black. But that is not a sustainable situation, and it's only possible with significant allocations of resources from the federal government. The city has also worked hard with the school district to improve, as I said, their nutrition. We continue to work aggressively to enroll more kids in the Children's Health Plan Plus, the CHIP Plus plan. We get additional federal funding from Ryan White Care. I mean, this is all the context that I think almost everyone here knows. What I want to really point out is that what's going to happen in the next period of time, and Matt Miller, who's with the Center for American Progress and has been, they've been one of the real leaders on this, and we were talking, I think about a month ago at the Hope Street group in Washington. But the real key on this, and there's going to be a narrow opportunity, is to change the way people think about this. And that's going to require everyone in this room to be proselytizers in one way or another. And, my favorite Abraham Lincoln quote was that, and I talk about this in a variety of contexts, often when I'm talking about homelessness, but that, he was asked right before the first Lincoln-Douglas debate, was the presidency more important? Was it Congress, the judicial? Where was the greatest power? What was most important? And he said, you're missing the point. What's important is public sentiment in this country. And then he went on, he said, with public sentiment, nothing can fail. Without it, nothing can succeed. That is why those who mold public sentiment go deeper than those who enact statutes or pronounce decisions, right? Legislators or judges. And I think that is truer today even than it was, 150 years ago. And that we need to begin thinking much more objectively and in a much more ambitious level of how we articulate and to whom we articulate these basic issues. How do we distill it, and how do we communicate it in ways that people will take with them and begin to change that public sentiment? I had a writing teacher in my earliest incarnation. I wanted to be a writer. I actually have a very pathetic half manuscript of a novel from when I was in college. Shudder even to think about it. But I did have some great teachers, and there was a guy named Paul Horgan who taught at Wesleyan University, and he walked into class one day and he said, everything has been said, but not everything has been said superbly, and even if it had, everything must be said freshly again and again. And that's really, today, hopefully you'll come away with a whole new sense, a whole new universe of fresh ways of communicating these issues so that people get it. So you're all hereby officially deputized. Get to work.